Hello, I'm Ted Dale with the Washington State Department of Health, and I'm here to show you our new Certified Peer Support Specialist credential and how to get your staff trained up or you yourself trained up if you're a peer. So our credential, the Certified Peer Support Specialist, comes in to replace the agency-affiliated counselor for peers that are working in agencies. It is an independent credential that's not necessarily tied to agency employment. So peers aren't necessarily going to work in agencies, but they can work in agencies, and we'll show you how that works out here today. So there are educational and experience requirements to get the credential. We'll also go over how to become an approved supervisor for the trainees, continuing education requirements, and also the ethics of peer support. So, in looking at the educational requirements, certified peer support specialists and trainees are required to take an 80-hour course that's been developed by the healthcare authority or an approved apprenticeship program. So that's kind of the way coming forward now, but we also have a lot of peers that have been previously practicing in Washington State, and we don't necessarily need them to go back through and take the full 80-hour training. So for peers that are previously trained by the healthcare authority, they will need to have their 40-hour CPC training, and they need to complete the new GAP training for peers to qualify for the peer support specialist credential. The GAP training kind of brings in all the new materials that were added to make it the 40-hour course and 80-hour course, so it just ensures that everybody has all of the same information. The GAP training is available online for free and can be done at your own pace. And we also wanted to look at peers that are coming from out of state. Out-of-state peers typically have some level of training that's usually a 40-hour training, so they are also required to take that GAP training to sort of get that extra information. And we also want them to take the HCA peer prerequisite training to qualify for the credential. The prerequisite training it has information specific to Washington State and the rules of how it works. Both of those are available online for free and able to be done through the HCA's website on that. So either the 80-hour course or the 40 and the GAP training will work to meet the educational requirements, or if they're coming from out of state, they need the GAP training and the prerequisite. For the experience requirements, it requires 1,000 hours of supervised experience as a peer support specialist trainee under an approved supervisor. But again, we have a lot of people that have already been trained up and are out there working as peers now, so we don't necessarily need to make them go back through and get another 1,000 hours of supervised experience when they may have been practicing as a peer for years. So peers with previous experience can meet the requirements in one of two ways. They can either be an agency-affiliated counselor working as a peer counselor for at least 1 year in an agency, or have 1,000 hours of peer experience without any DOH credential at all. Those are the non-trainee experience hours because you didn't get them under the trainee credential going forward. So there is an attestation form that they'll need to have filled out and will need to be signed by the employer or behavioral health provider that can attest that yes, this individual did provide those hours as a peer counselor or peer support specialist. When looking at your hours from before the DOH credential, the time starts after you've taken the 40-hour certified peer counselor training. So sometimes AACs can start working before they've had the training and they get into the training after that, or people might have worked as peers before they took the training and then, took it later on. The time that we're looking at for the hours starts after they have the CPC training, the 40-hour CPC training from HCA, and that's when you start counting the hours. To find it, you can go onto our DOH website. We have a menu on the left over here, and you can see under certification information is where you can find the forms. You can apply online through our online licensing system, or you can print out and apply on paper. Whichever way you do it, you're going to need to provide one of these two additional forms here at the bottom, the verification of trainee experience or non-trainee experience, again, which is done as your experience as a CPSS trainee or your experience as an AAC or without a DOH credential. So that form will need to be printed, signed, and sent in by the supervisor, not by the applicant themselves. All right. So we've talked a little bit about the agency-affiliated counselors, which is how peers had previously practiced, and we want to compare that to the new Certified Peer Support Specialist certification because there are differences between these two credentials. So the working in an agency required you to have a credential of some type, and so that went into the agency-affiliated counselor. The new Certified Peer Support Specialist has a different scope of practice. It has different requirements that come in here to meet it, and the two credentials are just set up differently. So you can continue to provide peer services as an AAC through December 31st, 2026. But starting January 1, 2027, all peers will need to have an active CPSS or CPSS trainee credential. The other concern or difference between the AAC and the peer support specialist is that the AACs can practice while the credential is pending. So you can bring them in and get them working right away and then fill out the application and get them going forward. That is not the case for the CPSS. They need to have already had the training from HCA, and they need to have an active CPSS or CPSS trainee credential before they can start providing services in an agency. So that's a big difference to have an active credential to come in uh, compared to bringing them in and then getting the credential going. The other aspect to look at between the two is the scope of practice, and the CPSS is more limited than the AAC. And AAC is kind of a catch-all. You can do a lot of different work of that. You can provide, mental health or SUD counseling. You can run the groups for the main provider. You can provide case management, different things in there that fall under the definition of counseling as an AAC. CPSS can only provide peer support services and peer interventions. So they can't do case management or run SUD groups. They can run peer groups, but not SUD groups. So, depending on what the individual's job duties are, they may need to maintain both credentials and have an AAC and a CPSS to be able to do both aspects of their job, to wear the different hats as it is between the two credentials. If they're only providing peer services, then you can let the AAC lapse and just go forward with the CPSS, but it's going to depend again on the duties of the position where you have and what the agency is asking them to do. The other aspect of this credential is who's an approved supervisor and who can supervise these trainees. I would first note that for supervision, we're talking about an approved supervisor. This is just for trainees getting their hours to become a full peer support specialist. They may also have a day-to-day supervisor that's not a peer or is not a behavioral health provider that is just kind of does the day-to-day activities for that. And that's fine, as long as they also have the approved supervisor that they're meeting with at least twice a week, is familiar with their work, and can provide that supervision for those licensing hours in addition to the supervision that's provided from the day-to-day. And then the full CPSS peers, there are no requirements on who can be their supervisor. They don't have to be under an approved supervisor. And so just for clarification of language, approved supervisor means someone that's supervising a trainee. So it can, like I noted, it could be a behavioral health provider as defined in the statute, or a certified peer support specialist who meets the requirements in WAC to be an approved supervisor. So the behavioral health providers are a lot of your mental health counselors, social workers, SUDPs, and so it includes a lot of the counseling professions that can provide that training or provide that supervision, and then also the peer support specialists who have to go through the joint supervision requirements to be able to meet that. I would also note that the supervisors are limited to being able to provide this supervision for 3 years. So that's something else to think about and plan ahead. If your agency is working primarily with clinical providers, that you will need to get some peers that are trained up to be supervisors before 2028, July 2028 rolls around. So, what is it that the peers need to do to be able to be trained up to be a supervisor? They have to have at least 1,500 hours of work as a fully certified peer support specialist providing peer services. So we aren't counting any of the trainee hours. This is 1,500 hours in addition once they have the full credential. And 500 hours of that needs to be attained through joint supervision of peers. So joint supervision is essentially working with an approved supervisor to learn how to become a supervisor. You would work with the trainees. You would see how they provide the supervision. They could give you tasks and stuff to work on to learn how to do it yourself and train you up to become a supervisor. 500 hours is typically about 3 months of full-time work, so it can be done fairly quickly. The requirements are listed out in the WAC. We also have put in some how current supervisors can provide supervision. If you've already been supervising peers and you keep coming forward, there's a way that they can meet the requirement to be an approved supervisor, but they do need to be have an active peer support specialist credential and have provided supervision to peers previously for at least 1 year. So what is joint supervision? Joint supervision isn't defined in the statute, so we kind of defined it in the WAC. And it's essentially working with an approved supervisor to learn how to become a supervisor. We developed a definition for a peer support specialist supervisor candidate. So this is an individual who's not a supervisor, but they're working to become a supervisor. So they may be doing some of those tasks with the supervisor coming forward. It outlines that time frame that they're eligible to do it, which we talked about with the 1,500 hours, getting 1,000 hours first, taking the supervisor course, and then getting your 500. And then it also lists tasks that they should be doing and things that they shouldn't be doing to learn how to become an approved supervisor for peer trainees. So that's all developed in the WAC to be able to go forward with that. So what about those current peers who are supervisors? We can get the experience that was earned prior to do this, and they can use their previous experience to become the CPSS. They can use their previous experience as a supervisor of peers to become an approved supervisor. All of that does need to be attested to by either their employer or a behavioral health provider that worked with them to attest to it and say, yes, they did provide this work as a peer, and then bringing all that forward. So if you have a very experienced individual that's provided peer services and supervised peers for a long time, they can send all this all in at once. They can send in applications, training forms, experience forms, supervision forms, send in the whole packet for that, and get everything done all at once based on their previous experience for that. So we're trying to basically get everybody that's been doing the work in without having to redo everything and get retrained or get more experience on top of that. So if you are applying as an approved supervisor, you'll see we actually have this page has another form down at the bottom underneath the experience forms for the joint supervision. It's a two-sided form. It has experience going through the joint supervision process as outlined in WAC to attest for those hours. And then it also has another option for people that had a previous supervision experience for this and had supervised the peers for at least a year coming in, but didn't do it through the joint supervision process. So that's all of them in the same form to become a supervisor. It's not a separate credential. We don't issue a credential for a supervisor. We just note it on the certified peer support specialist credential you get that this person is also an approved supervisor. Continuing education is also required for the certified peer support specialist credential. It is not required for the trainees. So the CPSS needs to have 30 hours of CE every 2 years. I would also want to note that this doesn't start until you get your first full 2-year issuance of a credential. What I mean by that is that when you initially apply for our credentials, we align them to expire on your birthday. And so it's supposed to be easier to remember. It expires on your birthday every 2 years because this is a 2-year credential to help you remember when you need to renew your license. But we don't require CE if you have a partial issuance. So if you apply for the CPSS 6 months before your birthday, you're going to get the credential for a year and a half, and then it expires on your birthday. We don't require CE in that year and a half window. We require it on the next one when you have the first full 2-year birthday to birthday issuance. So don't plan on trying to do your CE ahead of time. If you have a partial issuance for that, it's only needed for when you have that first full birthday to birthday 2-year renewal cycle coming forward. We have developed a list of known CE providers that we listed in WAC. So there are some in there that we know can provide it. They include peer-specific organizations and other counseling organizations like ASWB or MBCC that provide a lot of training already. So you can get different providers can provide different types of courses. There's also a handful of courses that you're going to need to have that aren't necessarily on the exact same 2-year renewal cycle that you're going to want to be aware of. And this is actually applicable to all DOH credential holders have these different ones coming out. So one of them is suicide prevention. You need 3 hours every 6 years. And there's a health equity training that's required 2 hours every 4 years. The department provides those trainings. We have links to approved courses for that, so it's easy to find on our website. And you can look them up and you can take some of the different courses. Generally, they have a mix of online and in-person ones, but it seems like everybody prefers the online ones. There's also a telehealth training. That's a 1-hour training that's required to do before you can provide any telehealth services. And that's a one-time. You don't need to keep renewing that one. You just need to do it once, and then you can provide telehealth services going forward. The last one is supervisor courses. So if you're a peer support specialist and you're an approved supervisor, when you do your 30 hours of courses, you need to have 6 hours of that needs to be in supervision courses going forward. Okay. And also the CE courses are only valid for the current CE cycle. So like I'd mentioned, don't try and work on them ahead of time. If you get one of those partial year ones, the courses you take in that time are not going to carry over to the next one. It's going to start on that birthday and then end on that birthday 2 years later. And you need to do all the courses within that 2-year window. All right. So again, we listed the provider. It needs to be, the CE courses need to be provided by an industry recognized local, state, or national or international organization or institutes of higher learning. So colleges and universities. There are providers that might not be listed on there. They just need to be an organization, a professional organization for counselors or for peers or whatnot that can provide those kind of trainings. DOH doesn't approve the providers for that or approve the courses for it. It's really up to the individual places to prove that they are a training provider for that. So we listed 30 hours of CE that is required every 2 years, and that's broken down into smaller subsets. So training for peer organizations of peer-specific courses needs to be 14 hours of that. An additional 14 hours can be related to other aspects of mental health or SED counseling, which could include coaching, counseling, professional development, and your employee-sponsored trainings and stuff. So if your employer gives you different trainings on something that's specific to counseling or peer work or something, those can also apply. There's also ethics course for the final 2 hours on there. You have to have 2 hours of ethics every 2 years because the law requires 6 hours of ethics every 6 years. So we just did it 2, 2, 2, so that over the 6 years you would have that 6 hours of ethics. Um, you also want to have to make sure that they get a certificate of completion that lists the name, the date of the course, and the number of hours that it's provided for. It also needs to list the organization that approves the CE, and we can take college transcripts if you're using higher education for that. Um, some organizations also provide the training, but they're not necessarily the approver. They will bundle the courses up, they provide them out, and they'll tell you separately, this course is approved by this organization, this organization, this organization. So you can find a lot of those online. And a lot of the courses are approved by multiple groups so that they can give them to nurses and counselors and other different people like that. And some of them are specific. They're only for nurses. So if you see something that's specific for nursing, that's not necessarily going to be acceptable for a peer. One of the other things that we worked on in our public workshops to develop these rules was ethics. A lot of the national and other states have ethical guidelines or a code of ethics or things like that that they put forward for that. And so we created that in the workshops with the rules, even though they're not specifically rules themselves. So we discussed this with shareholders and other, peers that wanted to kind of develop this to kind of figure out what we wanted to do, how we wanted to word it, and different things like that. So they fell out into two kind of groups of things that the peer specialist should do while providing those services and things that they should avoid to try and create conflicts, boundary violations, and things like that. So, and while they're not necessarily like laws that are written into the WAC for the profession, sometimes they are laws that violate the Uniform Disciplinary Act or some things like that. So there can be some overlap with the law, either with us looking at violations against your license or with somebody filing a lawsuit against them. So their ethical guidelines, again, they are guidelines. They're not laws and rules. They're just supposed to be best practices. And they are based on a lot of the national guidelines from SAMHSA, and then we looked at a lot of other states and what they're doing and how they do it going forward. But again, and they're not necessarily laws, but there could be. So you're not allowed to date somebody you've provided services to. And so if it turns out you start dating a former participant, or that participant is what we call a client in the peer world. So if you're dating somebody that you provided services to, that is a violation, and the department can investigate you and take action against your license on that or your credential going forward. So just as an FYI. Some final things I want to note for the peer support specialist is that the fee is capped at $100 for the first 5 years. And that is the fee for the certified peer support specialist. There is no fee for the trainees. One of the questions we get is concerns about this fees going up in the future. The department doesn't necessarily have control over how the fees are calculated. We're statutorily obligated to balance it out for the fees, so we can't make a bunch of money off of it, but we can't lose a bunch of money either. So we have to sort of maintain the balance on that going forward. So we will get several years of data while this is capped for the 5 years, and we'll kind of see where it needs to fall. And then after that 5 years, we'll come out with a new rate. Don't know what that is at the moment. But one of the biggest things that we can do is to keep the fees down, is to keep down disciplinary costs. Disciplinary costs are a huge driver of fees. And for some of our professions that have a lot of disciplinary action, sometimes almost 50% of the cost of the credential is going towards legal matters for investigations, staff attorneys, judges, all the stuff to be able to investigate and take action on people, that are violating the law. So keeping the disciplinary costs down is the biggest thing you can do to keep the fee for this credential down. The credential is also voluntary. It's specifically written into the statute that this is not required unless you're going to be billing for insurance or Medicaid. It's also required to be an approved supervisor for the trainees for our DOH requirements. And it's required if you work in a BHA, because for a BHA, they require people to have an active credential to be able to provide services. So it is required to do that. But the approved food supervisor, I have a note on here that the report to the legislature is in July 1, 2028. That is for behavioral health providers. If For behavioral health providers, they're only able to provide peer supervision for those first 3 years. So at that point, we're going to provide a report to see if there are enough peer support specialists that are trained as supervisors to be able to handle that load, or if they need to continue that for a while longer to build up the peer supervisor workforce and continue to allow the BH providers to come forward. So that's something we won't know till the future if that's going to be extended or if it is going to change to just peers supervising peers, which is the ultimate goal of the legislation. Again, the ethical guidelines are advice for not crossing boundaries and preventing investigations or disciplinary action. And as I noted on the bottom, the single biggest driver of fee increases is the disciplinary action for that going forward. Lastly, we have a list of resources for the statutes and rules guidelines. We have a fact sheet that you can provide to the clients that peers can hand to clients that explain what peer support is and how it's different than traditional counseling. We have our website, the bills that created it, and of course over to the Healthcare Authority, which is where you're probably watching this video now. It has my contact here at the bottom, ted.dale@doh.wa.gov, and you can reach out to me if you have any questions about the credential going forward.